Hi there, this is Sleeping again. It is another Sunday. Today I would like to share about the skin related disease or symptoms that I've seen which is markedly increased after the vaccination of COVID-19. This is the very obvious increase like chronic hives, eczema-like symptoms, psoriasis, so on and so forth. I don't know why, but the patients, they claim that they never had these symptoms before. Some of them don't even have any family history, but suddenly they do have these symptoms after the COVID vaccinations. It's days or weeks after their vaccinations. It can be the first, second, or the third dose or the fourth dose. But many of them are pointing towards the vaccination because of the time frame is too close. What I can think about, it could be the vaccinations that has awakened the sleeping genes, or it triggers autoimmune reactions to our body which may attack the skin and other organs. Today I'm going to share about a case of a 53 years old woman who is a primary school teacher. She suffered from chronic rash since the third vaccination that has bothered her for months. She has seen many dermatologists before she's seeing me, and she has been given methylprednisolone, 2 tablets, which is 10 milligrams twice a day, mometasone cream once a day, as well as levocetirizine 5 milligram once a day. So this is a very typical treatment that we would use on a hives patient if it is in acute hives. But she has been on this treatment for months, yet she hasn't seen any result, and she came to see me is because the rash was on her face, and the face rash is spreading, and this steroid will not help. Her left eye and forehead were swollen and inflamed when she came and see me. I have given her some conventional treatment which she has been using, but I altered the frequency a little bit. Plus I gave her some complementary medicines that in a very huge dose to reduce the inflammation and to stabilize her immunity. Right, for the first time I given her colostrum. It's a first day extract. Bear in mind that within 5 days we still called it a colostrum, but only the first day extract would have these medicinal properties. Others are just supplements. So when we're talking about colostrum here, we're talking about 24 hours extractions. I've given her a very big dose of bovine colostrum, then the fish EPA of 2,100 mg in 3 divided dose, and then the other one is tetrahydrocurcumin, 400 mg in 2 divided dose. So these are very high dose which we won't normally use as a supplement. So just to let you know, okay, this episode I do expose a bit of the dosage. However, I don't advise you to use if you have similar symptoms, because we do require very close monitoring. Right. Her methylprednisolone 5 mg, 2 tablets twice a day given by another doctor. I've modified a little bit to 4 tablets in the morning. That is to mimic her normal hormone cycle a bit better, so that she won't get insomnia. I still maintain her levocetirizine once a day. However, it's not necessary that once she's on her steroid, she needs to put on the antihistamine. The other one is I told the patients that she need to see improvement within 3 days, because we want to know that if her body is responding to the complementary medicines or not. 80% of the population will receive very good improvement within 7 days. On the 3rd day, she messaged us and give us a feedback that her conditions improved markedly. On the 7th days, I saw her rash disappeared almost completely. After suffering for weeks of the rash on the face, even steroid cream was applied, and even very strong oral steroid was given. She didn't have any improvement, but this time her rash disappeared. However, on the first week when I reviewed her, she developed hives. So these hives, compared to her previous hives, was not itchy. Previously, the level of itchiness was 5 out of 10, but now her level of itchiness is surprisingly 0 out of 10. So not itchy at all, but she developed sort of rash at the armpit areas and then the inner thigh areas, which lasted for about 10 minutes every morning. She complained about her face was pink after she exercised. This is quite normal because our blood flow will get a bit fast after exercise. However, we do take this as a concern, so we advise her not to exercise for now and stay in a very cool area between 16 to 22 degrees Celsius during the treatment time. And this time we need to look into her blood vessels and reduce the inflammation of her blood vessels. So normally when we look at hives, we look at inflammation of the blood vessels. We ordered a blood test which look into her full blood count, we look into her full thyroid function test, tumor markers, and we look into her total IgE, which is the allergy related reactions. So normally when we talk about chronic hives or urticaria for adult, we are looking into these 3 things. I would say probably 70% of my patients we will find abnormalities in these 3 parameters. So here we go. I have revealed for this time about her management of her hives I've given. So have a look at this. Another week has passed. The blood test has come back. So this time we realized that her T4 is slightly high. So that could explain why she has got very high heart rate and she developed chronic hives. But because the parameter is just slightly high, and her hives now for this, like the whole week, she only developed 2 days of the hives episode. So this to me, it could indicate that her body is getting more stabilized. We decided to monitor her T4 after 3 months, provided that her hives getting better and better and her heart rate is getting more constant instead of towards the high side. So we would probably monitor for now, and then 3 months later, so then we take another blood test and see. I hope that after 3 months her T4 will get stabilized due to the stabilization of the whole body. Then she might not need any treatment for her thyroid. So here is my very short sharing of this very interesting case. I hope you can share to your friends regarding this video. We don't know, a lot of them were suffering from abnormal disease or episode that never link to their family history or anything before, but after vaccination, or sometimes might not be the vaccination, it could be any viral infections like COVID, Coxsackie, hand, foot and mouth disease, something like that might trigger the autoimmune disease that might cause a lot of abnormalities. I hope with this video a lot of people start to recognize and know about review holistic disease management. It is a management that not only look into conventional treatment, which is just drugs. We also look into the internal balance, the external management, and environmental management. So it's a more complete management to a disease, which attracts a better efficacy and a better acceptance to the patients. Of course, to do this, we need extra knowledge and to know about things outside just medications. All right. Have a good day. I shall see you next week.